When assessing blood pressure, you must make sure that the participant has not had any caffeine or nicotine within the last 30 minutes. Also, they must have rested for at least 5 minutes prior to assessment. Make sure that their feet are placed firmly on the floor and not crossed, and that their back is up straight and supported. Make sure that palms are upward at heart level. Make sure that the appropriate cuff size is being used to ensure accurate measurement. The cuff sizes in relation to body size can be seen on the cuff, and the cuff should encircle at least 80% of the upper arm. The sphygmomanometer measures air pressure in millimeters of mercury and uses a bulb to inflate and a valve to deflate. Make sure that the brachial artery mark that is shown on the cuff is lined up with the brachial artery in the arm when you place it on the participant. Participants should have bare arms in order to get an accurate reading. The cuff should not be too tight to where it hurts the participant, but also not loose enough to fall off. It should be just right with a snug fit around the arm. Remember that 2 measurements should always be taken of blood pressure with a minimum of 1 minute apart, and the average of both measurements should be taken. 2 fingers should be able to fit under the cuff between the artery. The stethoscope has prongs at the top and should always be facing forward into your ears and never backward. Make sure that the stethoscope is on by twisting the bell until you can hear a sound in the diaphragm. Place the stethoscope below the antecubital space over the brachial artery. Inflate the cuff pressure to 200 millimeters of mercury and slowly release the pressure at a rate equal to 2 to 5 millimeters of mercury per second. The systolic blood pressure will be the first thumping noise that you hear, and the diastolic blood pressure will be the last noise you hear before the disappearance of the crot cuff sounds. The following chart represents values of blood pressure. For normal blood pressure, the systolic must be less than 120 and the diastolic must be less than 80. For prehypertension, systolic is between 120 and 139 or diastolic between 80 and 89. High blood pressure hypertension stage 1 has a systolic blood pressure of 140 to 159 or a diastolic of 90 to 99. High blood pressure hypertension stage 2 has a systolic value of 160 or higher or diastolic value of 100 or higher. And hypertensive crisis, where emergency care is needed, has a systolic blood pressure higher than 180 or diastolic blood pressure higher than 110.